Hi, this is Dr. Paul Goldberg from the Goldberg Clinic. Today we are with Mr. and Mrs. Broderick, and they are from Brentwood, Tennessee, which is from near Nashville?
Just south of Nashville.
Just south of Nashville. And Dan, Mr. Broderick, has come in today because he is here for a re-examination, which we just completed. And it's been about 2 months since we saw you?
2 months, just
a mere 60 days since we saw Dan. And Dan, tell us what brought you to the Goldberg Clinic originally. What kind of problems were you having?
Originally I came here, fatigue, I was tired a lot, my muscles were sore, my joints were sore. Just overall didn't feel good, and I couldn't keep up with my grandkids, which I wanted to do.
And they're pretty young, aren't they?
I got 3 of them, one's 2, one's 4, and one's 6.
Yes.
So just trying to get overall, trying to feel better. I had gout, I had some gout in my toes.
You had gout in your toes,
And I was getting some reactions, some swelling, the allergic reaction that I couldn't find out if it was food or medicine or anything.
Okay.
So I had many things going on.
How was your blood pressure when we first saw you?
Blood pressure was very high. I mean, I was on blood pressure for a long time, medicine, and then I got off the medicine, and it's gone down. It was 150-ish overnight. I don't know if you had the numbers over there.
Right.
And now it's down to 140 over 30s and early low 30s. So
Yeah.
I mean, 140 over 80. Sorry.
Yeah.
Yeah. So it has gone down significantly in 2 months.
Yeah. So we're early in the game here. We've just been doing this for 2 months, and as I was explaining to Mr. and Mrs. Broderick that we are looking to actually create a new body as much as we can. So we want to have cellular turnover, and cells generally take, even the fastest growing cells of the body, take about 3 months. So when we start seeing improvements in just 60 days or less, we know we still have a lot to do, but we know we're on the right track. And of course, we're always happy to see symptomatic relief for the patients. Of the symptoms that you've had that have improved, what is the one that you're most happy about?
Wow. I would say that the swelling, I was having reactions where my face would swell up, and that was scary.
Mm-hmm.
And that has all gone away. I haven't had that in 2 months. But even the pain, the everyday pain of the joints and the muscles and the gout in my toe,
Right.
I'm really happy they don't have that anymore.
Yeah, that's something that we're all better off without. And during that time, did you lose weight?
Yes, I've lost, so far I've lost about 12 pounds, I
Mhm.
believe. So, and I'm feeling much better, down to my high school weight, where I graduated from high school.
And
So-
did we tell you we were putting you on a weight loss program?
No.
No, we did not. We never, ever put people on weight loss programs. We just want them to get healthy so their weight will normalize. And Mrs. Broderick, what have you noticed different about Dan over this past 60 days?
Well, his swelling was an issue. When his mouth would swell, we would be in the ambulance going for, whatever, shots, steroid shots.
Steroid shots?
From
swell,
swelling into
yeah,
your mouth and
yeah.
throat, and your face swells up,
Right.
and they're panicking. So I'm glad, now he speaks in front of people when he's not scared of swelling up anymore.
Public speaking.
Public speaking.
That's a big advantage.
Yeah, to be at a podium and start swelling is really scary.
Right.
So he's more at ease.
Yeah.
He trusts his body more.
Well, that's a good thing, because it's no fun to go through life in pain. All right, and so we're doing some re-examination of Dan. We're going to rerun a few tests. We expect everything to be improved. We're going to see how much, and I'm encouraging Dan to stick with this right now. And of course, we'll talk with him in just a few weeks, again, after we get his test results back, and encourage him to stick with it and make any minor alterations we can, because as much improvement as he's had, and the percent improvement overall has been approximately what?
I said 80 to 90%. I feel great.
80 and 90% improvement in 2 months, and we want to make sure that sticks by making sure we get a good turnover of new cells in his body, because we're really trying to not just suppress symptoms. That's not what we do. We're trying to, with Dan's cooperation, actually create a new body. And I think that it's important to add too that Dan's success is largely due to Dan, and I think the support of his wife as well, in following through, because all we can do is help to give instructions and recommendations. It's always up to the patient to actually make that successful circle complete. So thank you, Mrs. Broderick. Thank you, Dan.
Thank you. Appreciate everything.